Hello, everyone, and welcome to this press conference from the Premier François Legault, together with the Minister for Health and Social Services, Christian Dube, as well as the National Director of Public Health, Dr. Horacio Arruda. Mr. Head of the Government, the word is yours. Yes, thank you. Hello, everyone. When we look at the situation concerning the number of daily cases, we can see that the situation is stable and has been so for 5 weeks. So we are at an average of about 1,000 new cases every day. However, if we break down the regions one by one, what we can see is that in certain places there are big improvements, and in other places things are deteriorating. So let's take, for example, the Quebec City region, the national capital. We can say that in the past few weeks, apart from the Charlevoix region, there does remain a problem in the Charlevoix region, but in the rest of the national capital area, the situation has improved by quite a bit. In Montreal, things have stabilized in the past few weeks. There's been a small decrease, but things have stabilized. However, there are two regions that have deteriorated quite a bit, the Saguenay-Lac-Saint-Jean and Lanaudière North. You can see Christian also has graphs for each of those regions, but what we can see, if we take the regions one by one, the Saguenay-Lac-Saint-Jean, there are two places where things have progressed significantly. So Lac-Saint-Jean in the eastern area around Alma, where there's even outbreaks at the hospital over there, and there is Jonquière, where there as well there is a large increase. So we have a problem, and have had for a few weeks, with the Saguenay-Lac-Saint-Jean region. The other region is the northern area of Lanaudière. Remember, during the first wave, we had mainly problems in the Lanaudière South, which was, due to the Montreal situation. But now things are improving in Lanaudière Sud, or South, but there's a large problem in the northern part, particularly around Joliette. I know that there were problems with the bingo, but it goes beyond that. In the northern area of Lanaudière, there really is a problem. So I wish to ask to the citizens of those two regions, amongst others, so Saguenay-Lac-Saint-Jean and Lanaudière North, to pay special attention to reducing your contacts. So the rules remain the same. A 2-meter distance, wearing a mask when you are inside, in businesses, and be prudent. It is very important. Because if we hadn't had these increases in Lanaudière Nord and Saguenay-Lac-Saint-Jean, we would have seen an overall decrease in the average in the number of cases. Now, if we look at hospitalizations as well as deaths, there's a strong increase today, but it had been a certain number of days that on the hospitalization front we were able to see a decrease. If we look at the numbers of the second wave, so if we want to compare ourselves with other regions, we put it as of the 1st of September. So if we look at the situation as of the 1st of September, if we go on the deaths side, cumulatively in Quebec, we've had 71 deaths per million inhabitants in Quebec since the 1st of September. It is important to keep that in mind because we do have to encourage ourselves. We have succeeded a lot better up until now in this second wave than elsewhere in the world. So as I was saying, 61 deaths in Quebec per 1 million inhabitants. In the United Kingdom, it's 76, 98 in France, 145 in the US, 153 in Spain, 165 in Belgium. So generally speaking, there's one country doing better than we are, which is Germany. They are very disciplined. However, we have to remain prudent. We're not safe from an explosion such as what we saw in certain of the countries that I have just named. Just think about having a few parties with a few people, and after that, things multiply exponentially. So we're not safe from something like that. We have to remain prudent. Bravo. We have made gains. We have reduced contagion. But we're not safe from a tsunami of hospitalizations. So we are still around 500 hospitalizations. That's been the case for about a month. So that's good. So that means that our health network is holding up, and that is good news. I would like to end by saying we're starting the month of November, and we know that even when there is no pandemic, November is never easy. It's dark, the cold comes. But, this is not the first month of November that we get through, and I'm sure that we'll be able to get through it. And at the end of December, the days are going to start getting longer, and then we'll start going towards spring. And it is important that we continue all working together, all Quebecers. We can get through this winter.
Good afternoon, everyone.
English.
Our situation continues to be better than in Europe and in the United States, and I thank you all for that. But we must do better. Quebec City has quickly reacted, but there are other regions where we're not doing what we must. In Saguenay-Lac-Saint-Jean and in the north of Lanaudière, the situation is worrying. I ask you to reduce your contacts. So November will be difficult, but Quebecers know one thing. We know that the days will eventually get longer and that winter will pass. So we'll continue to help each other get through this together. Together. Merci, Philippe. Thank you.
Merci. Première question, Louis.
Thank you. First question. Mr. Premier, Dr. Arruda, my first question is for you. Dr. Tam today talked about, or actually emitted the recommendation of wearing masks, non-medical masks, with 3 plies. So 3 different thicknesses, including something that would filter inside. So filter, are you emitting that same recommendation? Are you saying that Quebecers should follow that recommendation? We know that face coverings don't all have the same level of efficacy, and then the number of extra plies add ultrafiltering. It makes it a little bit more difficult to breathe, but we cannot be against that element. But we have made work with the UNSST that is going to come back to us with certain standards of face coverings that could sometimes almost get to the level of medical-grade masks. We're working on that with the CSST in order to be able to give businesses certain standards, those that manufacture them. But I think that the recommendations of Dr. Tam cannot hurt, particularly if you're comfortable with such a mask. However, having a mask that makes filtering more difficult so that people don't wear it doesn't necessarily make things better. But it is a good recommendation. We'll get back to you with a recommendation either for home or for businesses. My second question, Mr. Legault, is very simple. 2 words. Biden or Trump? I have no intentions of getting into that. If we were having an election here, I would not want for other states or countries to meddle into our business. I don't think your answer will have much of an influence on the election results. I agree with you. Still, I have no intentions of committing myself, whether it be on the United States or the rest of Canada. I'll ask you the question in a different way. What is your greatest concern following the election of the U.S. election on the impact that it might have on the Quebec economy? Well, the most important file of concern, and I've talked about it with the premiers of other provinces and together with Justin Trudeau, is everything that we could call Buy America and Buy American. We are in a situation where right now, over many contracts, including, for example, public transportation, we know that we have Bombardier and perhaps eventually Alstom. Bombardier that would have its North American headquarters here in Quebec. But we can see that on these bids, there's a requirement of U.S. content of 70%. 70%. We, with the agreement that we are ratifying, or that Europe is ratifying with us, we have a maximum of 25% of Canadian content. So there's kind of like an injustice. What would be ideal is that Canada be included in the calculation of the 70% of American content. So for me, it's very important to see with the new president And we're going to continue using the links that we have quite a bit with the Massachusetts, New York, and California governors, with whom we have good links, in order to fight against this protectionism that is exaggerated. You had a call from President Macron this morning, which reinforces the distance that you have with Prime Minister Trudeau on the question having to do with caricatures. Well, yes. Emmanuel Macron did, in fact, call me this morning to thank me, amongst others, of the clear position that we took to defend freedom of expression, freedom of speech with no hesitation, with nothing to hide from. It's unacceptable what happened. A professor was decapitated in France because he showed caricatures of Mohammed, or that came from Charlie Hebdo. That is unacceptable. Of course, there are certain political leaders who fear terrorism and who, in front of these radical groups, are ready to do things that are not reasonable and to give in to this kind of blackmail. So I told the President Macron that we are exactly where he is, that we're there to support him, and that we are having the same debate in Canada. We side on Act 21, defending multiculturalism. We are going to defend the fundamental values of the Quebec nation, like freedom of speech and like secularism. So we talked about that. So without saying his name, you are sending a message to Justin Trudeau. Well, I don't want to speak instead of Emmanuel Macron. That is a private conversation. But I clearly said yesterday that I do not agree with the reserves that Justin Trudeau emitted, about condemning without any kind of reserve what happened in France. Do you think that the Prime Minister of Canada is giving into this blackmail that you were talking about? Well, it's the entire question of multiculturalism, is that the Quebec nation has values. We have the right to defend those values. Among those values, there is freedom of speech. There is secularism. There is the French language. And it's not true that in the name of multiculturalism, we are going to put that aside and we are going to make compromises that are exaggerated. Mr. Trudeau has refused to commit himself to not fight against Act 21 in Quebec, which is supported by the vast majority of Quebecers, and his words on freedom of speech for me are not acceptable. Do you have the impression that you were instrumentalized by Mr. Macron to transmit a message indirectly to Justin Trudeau? And are there any other subjects that were touched upon during this telephone conversation? For example, did you talk about the pandemic? Well, yes, of course. First, we spoke about what happened over the weekend in Quebec City. We spoke quite a bit as well about the pandemic. But this is a friendship which is reciprocal. That is to say that, yes, I will support Mr. Macron, and Mr. Macron tells me not to hesitate if I need his support. So I think that it's a nice friendship that we've developed together. Mr. Legault, Mr. Trudeau's position on freedom of speech, is that something that you find embarrassing or that makes you uncomfortable? Well, I don't agree with him. What I've understood is that the Bloc Québécois and the Conservative Party, either they don't agree with him. There is a debate in all evidence in Canada about this, and I believe that it is non-negotiable, freedom of speech, so it is a bit awkward. I'd like to come back a little bit on the pandemic. You don't want to close down the schools. You have said so over and over again. There's not much leeway left to decrease things because now things are stable, we're in a plateau, but we're not yet decreasing. Are you excluding in the short term closing down shopping malls? We're not excluding anything. And I think that every country in the world is doing the same thing. Nobody's excluding anything, but we have to be prudent. When we say that it's stable, we've had some good improvements in certain regions, but now there are other regions that are increasing the number of cases. We have to be prudent. When we say it's stable, it's not stable everywhere. For example, here in Quebec City, if we had been able to have the decrease in Quebec that we had in all regions of Quebec, it would have been really great news. But for the future, when I look at what is happening elsewhere in the world, we're almost lucky to be at 500 hospitalizations. But depending on how things evolve over the next few weeks, I think no country can exclude anything whatsoever. The microphone is off. Just to show you that right now in our website, once per week, we have graphs regionally to show cases, hospitalizations, and death rate. And what you'll be able to see, because I know you can't see it from where you're sitting, but now on the website, you'll see quite clearly that Montreal is stable. And Montreal includes the Montérégie region, which has not yet gone down. So that means that Montreal has performed really well over the past few weeks. First of all, what the Premier just said is that Quebec went down, Quebec City. So imagine you take the two largest regions in Quebec that have gone down, but unfortunately, there are increases that we see in the segment. I don't want to repeat what's been said, but you can see it very well in these graphs. So I invite you to have a look at them because that is what encourages us right now. And that is what, I was talking to the people of the Saguenay region this morning to explain to them that if we can see the same improvements that we saw, for example, in the regions that have had measures since the 1st of October, we might be able to 600 or 700 cases if we'd had those 7 decreases everywhere. So I find that encouraging. And we know that the 2 or 3 regions where we need, the Centre du Québec, Saguenay-Lac-Saint-Jean, and the Montérégie regions, this is where we need to see those corrections. And that would have a global effect over Quebec at large. That would be significant. But anyway, you have those graphs now on the website. Patrice Bergeron. Mr. Premier, so you spoke with Mr. Macron, amongst other things, of things having to do with secularism. And here there's a trial as well concerning Act 21. And you saw that there was a very important jihadist attack in Vienna. The United Kingdom has just announced that they are increasing the alert level. Here in Quebec, are there changes on the alert, or will there be extra surveillance, for example, about everything that is happening? Not according to the information that I have. There is no change in the level of alert. Now, concerning the pandemic, it's been many weeks now that we are in a plateau. There have not been any new announcements from your government on any other fronts concerning the fight. You said you didn't exclude anything, but if we really wish to decrease the curve, shouldn't we target other sectors? What we're doing today is we're targeting regions, as I said, and I'm repeating it. If we had experience all over Quebec, what we've experienced in the past few weeks in the national capital, we would have seen a great increase. So we have to make efforts. We have to say bravo to the people of Quebec City, and other regions have to follow suit in order to be able to see a decrease globally. The good news is that we remain with about 500 hospitalizations, and when we compare ourselves with France, that is at 25,000 hospitalizations, well, I'm thinking that we are lucky to be at only 500 hospitalizations. The second wave is strong. We are amongst the places in the world going the best so far, but we have to be prudent. And ideally, we have to break it to avoid an increase in the hospitalizations. At 500, we're okay. The network is under control. But there is a possibility that things will increase. There was an increase today from 27. There had been a lowering in the past few days, so I look forward to see what's going to happen over the next few days. To be sure that I've understood what you're saying, I can see that the results are asymmetrical from one region to another, and you're asking for additional efforts. But in as far as you visibly don't have the short-term intention of announcing more constrictive measures in Quebec, should we resign ourselves to see that number of daily infections that is going to last for a good while yet? And is that sustainable in the long term? Or in the long term, I mean a few weeks, perhaps a few months to have that level of infections? Where are we at 526 hospitalizations? If we maintain that number of hospitalizations, we can maintain it. To be honest with you, with 1,000 new cases per day, we thought that the number of hospitalizations was going to be higher, and it hasn't increased. So that's good news on that front. And Dr. Alain Poirier from the Eastern Township said that there's high-level discussions with public health and the Executive Council Ministry on the opportunity of reopening restaurants in red zones. And he even says that those discussions should, be over around the 9th of November and lead to something. Are you able to confirm that, whether these discussions have been taking place, and is it your objective to reopen restaurants in red zones? That's, if people are talking about this, it hasn't made it all the way up to me. Dr. Arruda, these are discussions that we have among ourselves in public health. We evaluate all scenarios to be able to give to a proposal that will be able to present to the Ministry of Health and the Premier, but we're not there yet. But that is something that you're studying? We study all scenarios because, the question here is to maintain a balance and coherence in what we do between what we close and what we open. So we're looking at every scenario. Olivier Bossé de Soleil, you were saying that there are certain regions of cases are going up and others are going down. Are we still following the color codes? Are some regions going to go back to orange? Because we can see that some increase, but can the color code be taken down? Yes, the answer is yes, and perhaps early. That's what we wish. Second question. Monsieur Legault, you talked about it yesterday. I'd like to hear you more on the link between Saturday's drama and mental health care that we give in Quebec, because the link has not yet been established by the investigation clearly, but what link do you make? Well, first, we said it very often. Health care in mental health for many years were neglected, a little forgotten, to the detriment of physical health. We started reinvesting even before the pandemic, and we have to do more. And since the beginning of the pandemic, we went from 2% of the public to 15% with problems of mental health. And it's not unique to Quebec. Of course, when people are more alone at home, there is a greater risk and of mental health. So there is an effort, a punctual effort to be made for the next few months and the next few weeks to be able to give services. That is why Lionel Carman announced yesterday that we're going to be adding services from the private sector. We add employees in the public sector, but we also buy services from the private sector. Now, I know that it's not always easy to negotiate with the police unions, but we would like to have a look at having mixed patrols because there are problems, social problems, which right now are sometimes treated by police officers, and there are police forces that ask to have more support. Now, despite all the efforts that we can deploy, we'll never be able to prevent 100% of violent acts, such as what we saw over the weekend. There are cases where people don't want to be taken care of, or things happen very suddenly, so we'll never be able to prevent those cases 100%, but I think that we can decrease them.
Oui, bonjour. J'aimerais d'abord qu'on revienne sur ce qui a été dit.
I would like for us to come back on what was said earlier on, because I put myself in the place of population who want to know what's going on. But when you say that there are zones that are red right now and that are going to be brought down to orange at some point, and what region are we talking about and what horizon are we imagining? what we said. I think that we are not, there might be changes. We're talking about changes that are a lot more specific, and maybe we'll scoop what we wanted to announce later on this afternoon. But for example, les îles de la Madeleine. Les îles de la Madeleine, for us, things have improved a lot, and I think that, they are in orange zone now, so we're going to be announcing this afternoon that they're going to go to yellow zone. But these are cases that are at the margins in terms of lowering. So more importantly, the red zones right now, and we know it's the greater regions of Quebec. We're not there right now, presently at all, because we haven't seen an important decrease. We've been repeating it for weeks. We saw a stabilization, but we have not yet seen an important lowering enough to be able to justify changing zones or changing colors in our larger red zones right now. I would like for us to come back to the deaths. 34 people more have died from COVID-19. This is a number that we had not seen for a long time. I think it goes back to the first wave. Is there here a trend, an upward trend that is worrisome? And to what extent are you able to say our problem, mortality, we find more in certain places rather than others? Well, I'm going to break down your question in two, because you know that we always have that problem when we arrive on Monday or Tuesday after a weekend. There are sometimes adjustments to be made. In the case of the death, and I think that it's explained very well in the press conference or communique that was sent off this morning, is that when we replace the deaths on the right day where they really took place, because sometimes the delays, there's autopsies and many reasons that sometimes make it that there's certain delays. The mobile average of the past 7 days is more around 18 to 20 deaths per day. The case of 34 cases today has to be readjusted over the preceding days, but it's not negligible. I think that is the worry of the Premier, is to say that each death is one too many. And unfortunately, now we are in the average of about 20 daily deaths, whereas 2 weeks ago, we were more around the zone of about 10 deaths per day. So there is an upward trend. Quebecers have to realize that this is due to the fact of having had 1,000 cases for the past 5 weeks who went through hospitalizations. And remember, we were saying it is unfortunately going to end, that death rate is going to, the number of cases is going to translate into hospitalizations, which will translate into deaths. So the average of 20 deaths per day is the result of having been at about 1,000 cases per day for many weeks now. But there aren't really more deaths regionally where we see the cases. And once again, the average, because we say it on the UNSPQ site, I think that the number that I was looking at this morning is 90% of deaths are for people who are 70 and over years of age. So it's always sad, regardless of the age. But the proportion of people affected in the deaths is always around the same portion of age, to answer your question. So first, Dr. Arruda, 2 weeks ago, we were presented with statistics that would allow us to say, or that allowed you to say, that we had to reduce our cases by 25%. So 2 weeks later, can we already say whether Quebecers have succeeded and answered that challenge? We asked, and maybe Dr. Arruda can answer, but I think that the nicest show that Quebecers responded well is in the Quebec region and in Montreal and in South, because when we give you the statistics of the Greater Montreal area, it includes all of it, including Montérégie, the surroundings. And when we exclude the statistics of the Montérégie, that you can see very well on our website, you can see that Montreal has had a wonderful progression. So, and a progression in the right sense, in the mean that, this morning I was looking at it, Montreal is almost now at 200 some cases per day, which is very good compared to a few weeks ago where we were at 400, 450 cases per day, not for the island of Montreal only. So there's been a very great improvement for the Montreal area. Quebec City, same thing. You remember how difficult it was in Quebec City. So the best response that I can give you is that citizens, from the measures that were made and the follow-up of what was made in the health measures for the past few weeks, I think that they have responded very well. So in that sense, we also asked a professor from University Laval, Marc Brisson, who made the study, to put those statistics back and update them, because they were based on September, if you recall, when we had showed that we had gone from 8 contacts before the pandemic and lowered it to 2 or 3 and then back up to 5 or 6. We asked him to update that again, and that will be with the October statistics. So as soon as that is available, we'll republish that study made by Dr. Brisson from Laval University, who did very good work. And I look forward to seeing whether we do have a materialization, of having lowered by 10, 15, 20% the number of contacts that we have been having. As far as the Montreal region is concerned, it depends on how we see it, but is it more difficult in Montreal for Montreal to go back towards an orange zone? Well, what I'll say is I think that we have to have hope, but the way in which we've made the measures, when we made decisions for Montreal, we said the greater Montreal area because we didn't want to end up, with people moving from one area to another. And I was able to talk about it with others as well. And I want to congratulate the work of Dr. Drouin, who does excellent work as well in Montreal. We can't just look at Montreal without looking at the regional area, because when we look at measures like bars and restaurants and showrooms, you can't isolate Montreal without thinking about everything else. So that is why I was saying we would have even better statistics for the greater Montreal area if we had had the same lowering in the Montérégie. Now Dr. Arruda is putting a lot of efforts, and maybe he can talk about it, about the Montérégie, because it is an important portion of our cases right now. So I think that it will be, I would say that the Montérégie region as well as the Lanaudière region, because we said earlier on, but it's more the northern area of Lanaudière that the Premier was talking about. But if we were able to, in the next 2 weeks, to improve those 2 regions, I think that it would be the greater Montreal area that could take advantage of it, and that's how we have to encourage ourselves. If I could add an element, it is clear, it is possible that the CMM is going to go to orange eventually, but you'll understand that when we are in urban zones, particularly in the metropolitan area and the national capital area, when there is a movement, things increase and accelerate quickly. I'm not saying that it didn't happen in the Saguenay-Lac-Saint-Jean, but in terms of numbers and etc., it remains. And I think that the Premier says this often, it's places where there's large cities, where there's a lot of transmission, etc. So it remains zones that we have to keep a very close eye on. But it could, yes, it could come back to orange. But we really have to follow that very closely. Tommy Chouinard, clarification quickly. We're talking about the fact that the Montreal region is going to go from orange zone. What horizon are we talking about? I mean, it seems to be like a reality that's close. That's not what I'm saying. I'm just saying that when we look at the curves, people are at the limits sometimes of red and orange. So sometimes it goes down a little bit. So we have to look not only at the number of cases, we have to look at the impacts on hospitalizations, number of outbreaks, ability of doing contact tracing. That's all the perspective. But you're thinking about it? Well, it's my dream, if you'll allow me. I mean, these are objectives to reach. We want to increase search and contain. We want to increase things. But I'm not saying that tomorrow morning we would be in orange. I'm just saying that it's possible that at some point we'll get back to orange. Now, what is important for us is to maintain that, to lower it, so that if ever we have to, let things go, then we don't go back up, too quickly. But I think it's really difficult for us to be able to say where we're going to be in 2 weeks. We will now go to English questions.
Good afternoon. My first question is about the election. I know that you said that you didn't want to proclaim anything or interfere, but do you have any concerns about what might happen if there is a process where the votes get contested or one of the candidates contest the result? Do you have any concerns about
of
violence?
course, for the economy, we never like to see some uncertainty. Business people, they want to know where they go. Even if it's a bad news, they want to know where they go. So it wouldn't be good for the economy.
My second question is about new stats from Suicide Action Montreal that came out late yesterday, and it says that there's about a 14% increase in calls in October, which suggests there is a mental health crisis, as Mayor Legault has underlined. How would you categorize the severity of mental health, depression, and anxiety among Quebecers right now?
But of course, when I said that before the pandemic, before the pandemic, there were 2% of the population having mental health problems. Now it's 15%. So of course, it's a major increase. It's like that about everywhere in the world. People are more isolated, so it's tougher for them. So that's why we've increased resources, and we have to be careful.
But it's not a crisis.
It's not a crisis. It's a large increase. So it's a very large increase, and we need to have more people. So we've hired people. We are contracting with the private sector also for some help, and we were able since last March to decrease the waiting list from 28,000 to 16,000. So even if the number of cases increased, the waiting list, we were able to decrease it.
Katsune, CBC.
Good afternoon. When we look at the number of cases, we're talking about 1,000 since 5 weeks. That's a lot. It's a never-ending plateau. So we know that you don't want to close schools, and now that there are 3 regions that are not doing super well for now, maybe like other regions will not do super well in the next few days. Who knows? What can be done?
I think if I may start with that one, is that I think there is the chance that we have in this second wave is to look at it by region, as you just said. If we look at what happened in Montreal, just the sole island of Montreal has been doing very well in the last few weeks. And the cases went from, and I'm limiting my comments to cases, but from 400, 300, and now we are in the low 200. That's very good news. The reason when we look at Greater Montreal or the CMM is that we have 2 regions that have some difficulties, Lanaudière and Montérégie. But if you had the same decrease that you had in Montreal, on the island, you had probably a situation from CMM that could, and this is the way we look at it, would have a trend for 2 weeks in a row. That would be very good. So I'm encouraged when we look at it by region. The second region is Quebec City. Remember how Quebec City had a difficult beginning of the month of October. And now if you look at the last 2 weeks, the number in Quebec and a little bit in Chaudière-Appalaches, when you merge them together, they have done, I would say, fairly well in the last few days. So yes, we look at the plateau for Quebec, but Montreal and Quebec have decreased substantially, but unfortunately, Saguenay, Lac-Saint-Jean, Mauricie, centre du Québec, and I said Montérégie, have increased and have annihilated the effect of the positive. So to me, it's a plateau for Quebec, but it's very good news for our two main regions. So I think and maybe the message is very simple. Let's do in those regions, Saguenay, Lac-Saint-Jean, Mauricie, Centre du Québec, and Montérégie, the same effort that have been done, and I think we'll be all right. That's a very simple message. We don't need to change anything, but we just need to do the same thing that was done. Stay at home, just go for essential, go to school, go to work, but go back home. And I think the month of November would have some very good result. But I think we have to look at it by region. And that's the reason I know those graphs are very small, but we have now those graphs on our website. And I think that will give you a very nice picture of the situation by region. I think that's encouraging.
And just to follow up on the 3 layers masks, Mr. Arruda, Dr. Tam is making this recommendation. We all wear different masks here. Like I'm using this one. It's not a non-medical mask with 3 layers. So what's your position? What do you suggest Quebecers? Is this a key to reduce the number of cases and get out of this plateau?
I think that there is key issues with, first of all, is 2 meters distanciation, which is for me the very one important, the washing of your hands and the masks. But the masks have different, and what I said, and I just see a publication actually from the SNEST, they will work with the Bureau de Normalisation du Québec and the lab of the IRSST for making recommendations for the fabrics of those masks. Some masks have 2 layers, and you can put inside 1/3 one that you can wash and use. So I think the recommendations of Dr. Tan are okay, but we are also working here in Quebec to have standards of quality for having fabrication of masks related, and those masks could be approved by le Bureau de Normalisation du Québec.
Philippe Autier, de Gazette.
Good afternoon. Good day. Do we have any idea of why? I understand the regional breakdowns and zones that are going worse and some that are improving, but we seem to be 4 or 5 weeks at this same plateau. Do we have an idea of what will it take to break that? Perhaps Mr. Dube, sorry.
Well, as I said, I was looking at today, and it's just the cases. We're not dealing with outbreaks or with the other criteria such as hospitals. But if you were to take the best of Montreal today, the best of Quebec today, and you were to say, if you would take the best of, Saguenay, Lac-Saint-Jean, and Montérégie, the best they had, say, a few weeks ago, you would be in the 700. 650, 700. That's encouraging. And this is exactly what maybe the simple message is. We have been, as Quebecers, since the month of October, to reduce substantially in our 2 main regions, Quebec and Montreal. I think this is quite an accomplishment. So, but unfortunately, we didn't have the same measures, for example, in Saguenay-Lac-Saint-Jean. And this is the reason we say, well, let's do an additional steps, and that's the reason I've been talking to a lot of people, talk to Santé Publique there, and say, well, it's never too late to do the right thing, and basically, that's the reason I think we need to be encouraged that it's working. And I think I understand your question that Quebec has a plateau, but the components are quite different. And if we're working on the success of the components, Quebec and Montreal, I think we should do very well in Quebec in general.
But on Sunday, this is my second question. On Sunday, we were down to 15,512 tests. Why are we so low on our testing now?
Well, again, my answer is very dull, but you need to look at an average of 7 days. The weekend is usually low. If you look at the stats that we have, Philippe, on our website, we always have we decrease the test by a number of 5,000 to 10,000 every weekend. this weekend is just a bit lower. Is it because it's colder? But I think you need to look at the average for the week is roughly at 24,000. And I think that I think what is important, Philippe, is that we test the right people. Our positive rate is still between 8 and 10%. So the good news is we're testing the right people. If we were testing 15,000 and have only, say, a 3%, we would not be testing the right people. So to have 800 cases and 15,000 tests, I think that's good news.
Kelly Craig, CTV.
Good afternoon. Looking at the comments made by the medical officer of Ottawa, she's suggesting that we learn more to coexist with COVID instead of seeing it as a kind of temporary restrictions or temporary lockdowns. Do you think that's a strategy that Quebec should look at kind of the long term? How do we live with COVID a year from now, 2 years from now?
Do we like to try to live with it? No. If I give you my personal view, but I think we need to learn to live with it. When we said, remember, a month ago when we presented this study from Marc Brisson that I was referring to, we said what is the new normality? To me, the new normality is wearing masks as we do, keeping that distance. I think we need to have a little gift sometimes. I think Halloween was a good example of things that sometimes that we can do differently in a different normality. I'm more focused over the next few weeks on decreasing the number of cases, and maybe we can have some little gift or little improvement in our normality, but I think this is there to stay for a while, and we need to be prepared mentally for that.
My second question is for one of my colleagues, specifically about gyms. Gym owners obviously some of them have been very vocal about the closures, but some are trying to survive by offering online training sessions from their closed locations, so they're by themselves filming for online. Yet we're hearing that police consider that illegal, even if the owner is alone in their gym. So why is that? What is the rule specifically on this?
To say that I didn't hear that.
Oh.
Honestly, that this was illegal.
Because the gyms are shut down, but they're using their gyms to film online sessions.
Let us check on that, because I think we ask people to be innovative, and if there is one way to find a solution, let's look at it. I don't know, Horacio, if you want to.
I will look at it and I will make sure that it's not an interpretation of what is written in the arrêté ministériel, because in fact what we don't want is groups to be together. If you're using your own local, even if it's a gym and it's not your home, I think there is no reason for that being a problem in the public health perspective.
We'll look into this. I think that's a good point.
Le temps le permet, je vais relayer une question qui a été transmise par...
A question that was transmitted by a journalist. Ontario has declared that if there's over 150 patients with COVID-19 in intensive care, all other care could be compromised. The Quebec Health Network, how many people can be taken in ICU without having to delay surgeries or any other care? Well, first I have to say that even at the number of intensive care that we have right now, it depends on regions, because we had to delay, we had to stop things in the Quebec region, for example, when things were more difficult a week or two ago. So the first answer is to look at things regionally. Secondly, the luck that we have, because we learned a lot with the equipments that we bought, is that intensive care really is a question of having equipment such as ventilators. And ventilators we have many of, so we would be able to theoretically increase the number of spots in ICU a great deal more than what we had at the first wave. So I'm answering two different things now. You know, it depends on the regions, but we do have a lot of room for ICU if we needed them, because we took a very high number of ventilators to be able to respond to that need if necessary. This puts an end to the press conference. We thank you.